Hello, and welcome to the start of the 4th season of Better Health. I'm Dr. Bobby Stowe, and this show is about you, the audience, the patient. In the next 30 minutes, we will explore, answer, and hopefully intrigue you to think about complementary and alternative medicine, the role it can play in your life, and how you can utilize it as a viable treatment option for many medical conditions. Over the last 3 years, it has been my pleasure to write and host the show in my attempt to help educate you on a variety of alternative ideas and therapies that exist outside of allopathic medicine. It was Thomas Jefferson who said, and I quote, "The doctor of the future will give no medicine, but interest his patient in the care of the human frame, in diet, and in the cause and prevention of disease," end quote. And so it is under this banner that I continue to research and bring to you what I believe are much better ways and methods of treating the human body and the diseases that occupy much of our lives, especially as we age. The problem that I see today, however, under our current healthcare system is that it's simply not healthcare. It is disease care. Think about this for a moment. Unless you've been hit by a Mack truck or have had an acute attack or an infection or some other issue, most visits to doctors' offices and hospitals are for chronic conditions. Now, I will be the first to admit that if you have an acute condition, an allopathic or a medical doctor, they're absolutely the best people to see and treat you. An example of this happened to me just a few weeks ago. I woke up on a Saturday night, a Sunday morning. I had very severe lower abdominal pain. I also felt I had a mass. So what did I do? I went to the ER at a local hospital and received wonderful care, was diagnosed with an acute condition that came out of nowhere, but was readily treatable with a heavy dose of IV antibiotics. Within 24 hours, I was back home. But I did my research and I figured out what happened to my body and how to avoid this condition from happening again. But this is where the story takes a turn. While the medical doctors were quite knowledgeable about treating my acute condition, their follow-up advice on how to treat a chronic condition was to put me on more drugs, possibly for the rest of my life. That isn't something I was really willing to do. What about the side effects, I asked? And they really didn't have a response to that question. So doing my research, I found what I believe happened and will now treat my own condition through my diet, and we'll wait and see what happens. My point in telling you my story is to ask you to consider how you can turn an acute condition into an easily manageable condition, and many times it can be done through diet. But what about really serious conditions like diabetes or Crohn's or hypothyroidism and other such lifelong diseases? Certainly these can't be treated through diet. Well, my answer is to not treat any disease. My answer is rather to provide the body with the nutrients that it needs in order for the body to function properly. Everything that I do for myself and my patient is to provide what the body needs at the cellular level. And if I keep my cells healthy, then it stands to reason that the organs that are made up of those cells will remain healthy, and then the organs that are in the body will remain healthy. Doesn't this make more sense than taking a bunch of drugs that in many cases cause more harm than good? And speaking of health, let's define what I believe health really is. Health is not merely the absence of disease, but rather a homeostatic balance of the systems and the processes of the body. It is the harmony of the 12 systems in our body that allows the body to function in a healthy manner and hopefully prevent disease. Again, this show has been designed to provide you with the information that you can use to be better informed about achieving and maintaining your health. Many times there are alternative methods for a given condition, and it is my desire to inform you about these treatments and therapies as we all strive and seek better health.
HCC Coleman College for Health Sciences is here for you. There are a multitude of careers in the medical field just waiting to be filled. In fact, there is an urgent need for more students to enter the workforce in the various health sciences. Whether you adhere to the philosophy of complementary and alternative medicine or conventional and allopathic medicine, both practices use medical technicians, assistants, nurses, professional coding staff, dental hygienists, sonographers, therapists, radiographers, phlebotomists, and many other medical technicians and staff. Houston Community College is a leader in providing education and training for the health sciences and is located in the heart of the internationally renowned Texas Medical Center. HCC Coleman College for Health Sciences provides state-of-the-art academic medical facilities and equipment for students to use as they learn their craft with hands-on experience as surgical technicians, dental hygienists, and pharmacy technicians preparing to enter the workforce. If you want to enter the medical field, HCC Coleman College for Health Sciences is your first step in making the right decision. Houston Community College. We keep Houston working.
Welcome back. Earlier I was explaining that I absolutely needed to go to a hospital and be seen by a qualified medical doctor because I trust them and I felt very comfortable that I would receive the highest quality care available. But last week I read a very disturbing report about a medical doctor in Detroit who was arrested and charged with Medicare fraud. In their criminal complaint, the federal prosecutors charged a Dr. Fada with ordering toxic chemotherapy for patients who did not have cancer or whose cancer was in remission. Why would anyone do this, let alone a doctor? Well, unfortunately, the answer is quite simple: for $35 million. It is alleged that Dr. Fada also ordered several other procedures for fabricated conditions or diseases that the patients did not have. Now, I should tell you that Dr. Fada has not had his day in court and that he denies all of these allegations. However, another doctor that worked with Dr. Fada and a nurse practitioner have confirmed they witnessed these wrongdoings, as well as several other nurses and employees of Dr. Fada's. So why am I telling you about this story? Quite simply to let you know that in all professions there are people of ill repute. But people put their lives in the hands and trust these doctors, and he took advantage of them and apparently put many of them at substantial risk. Should you or a loved one be diagnosed with a serious condition that requires extensive therapy, please get a second, even a third opinion. You only have one life to live, and the last thing any of us need is to be put in a situation that can be harmful to us, especially by someone that should be helping us return to better health. In yet another article that appears to cast doubt about the need for prescription treatments, researchers in the Journal of the American Medical Association, or JAMA, in August of this year, found that they had some real questions about the rapid increase in the use of testosterone replacement therapy. Apparently, researchers have found that there are many men who were treated with low testosterone, or low T as it's called. They didn't have clear evidence for the use of this prescriptions, and some actually had normal levels of testosterone or other ambiguous symptoms, but they were prescribed the therapy anyway. In the article, there were also two accompanying commentaries by the authors that suggest, and I quote, that the rise in prescription was driven by pharmaceutical companies' subtle marketing efforts to consumers, particularly given the concern about cardiovascular and other side effects, cardiovascular disease and other side effects, end quote. Then in an editorial by Stephen Braun from the Braun Medical Media Group in Amherst, Massachusetts, he explains how he was paid to trumpet the party line in ghost-written articles that he authored for a leading endocrinologist that ran in the magazines like Life After 50, Women's Day, and Business Week. He has also written a consumer-friendly booklet on behalf of Solvay, the original maker of Androgel, a testosterone gel, which presented an unbalanced view of the facts that serve primarily to drive people to their physicians seeking the holy grail of energy, positive mood, and sexuality in the form of testosterone. It was also noted that in the paper that the testosterone therapies are forecast to be a $5 billion market in the year 2017. Then, in an additional commentary by the doctors from the Veteran Affairs Medical Center, they wrote, and I quote again, "The Low T campaign follows a familiar script. Medicalize an ordinary life experience, raise the stakes to trigger testing, and then spin the evidence about the benefits," end quote. So here again, there is substantial evidence that the public is being manipulated by the pharmaceutical industry in believing that everything good and nothing bad can come from the drug companies. Another story that caught my attention deals with genetics. It's often been said by both medical professionals and lay people, you can't change your genetics. You know, your DNA. What you get genetically from your mom and your dad, that's what you have to live with all of your life, and there's absolutely nothing you can do about it. But is that really the case? I personally have often wondered if my environment and or what I eat could have any effect on my DNA, and now there's some startling new evidence that in fact genetic predisposition can be altered by what we eat. In an article published online in the journal Diabetic Care, researchers found that by following a diet known as the Mediterranean diet, people can not only reduce their fasting glucose and lipid levels, but people may also lower their risk of having a stroke. I believe I've mentioned the Mediterranean diet before in this program because it is a wonderful way of eating. Now notice I didn't say it was a wonderful diet. I hate the word diet because of the ramification that diet are foods that we eat for a short period of time. I believe that eating the best foods we can find all the time will provide our bodies with the proper nutrients that our bodies need in order to function properly. And what kind of foods am I talking about? Well, when people who were eating around the Mediterranean Sea thousands of years ago, they ate things like olive oil, nuts, fish, fruits, vegetables, and some healthy fats. So now science has again caught up with what many people have known for decades, that what we put into our mouths will have an effect not only on our current state of health, but might actually be able to change our genetic makeup and lower the risk of developing severe diseases like cardiovascular disease and stroke. We're going to take another short break, but when we come back, I will be introducing you to a remarkable doctor who has significant insight into the healthcare system as it pertains to all of Texas and the patients who want or need to see a doctor. If you have family or friends who are near the TV, please ask them to listen and watch this doctor explain why your health care might be at risk. So stay tuned.
We keep Houston working. HCC, smart decision.
Welcome back. I'm sure that most of you are unaware that several years ago, the Texas Medical Association and the Texas Medical Board filed a lawsuit against the Texas Board of Chiropractic Examiners because the medical profession believed that chiropractors were acting outside of what is called the scope of practice. In English, what this means is that medical doctors wanted to have all chiropractors in the state of Texas put under medical supervision. They sued asking the courts to declare that we chiropractors didn't have the legal right to diagnose conditions except as it pertains directly to the spine. The AMA also asked for several other items to be taken away from us because, again, they weren't directly related to treating a spinal condition. Fortunately, the Supreme Court of Texas ruled in the case last summer and determined that as of right now, chiropractors can continue to treat biomechanical conditions that relate to the spine, but that the scope of the practice relating to diagnosis are overly broad and invalid. Again, in English, what does this mean? While chiropractors can continue to help their patients, the court said that the Texas state legislation needs to get involved and clarify what we as chiropractors can and cannot do in order to assist our patients in their endeavors to become and stay healthy. So with this as a backdrop, I would like to introduce you to Dr. Tim McCullough. Tim has been a chiropractor for more than 20 years. He is board certified chiropractic internist. He's board certified nutritionist. He's certified in acupuncture. And in the state of New Mexico, he can write prescriptions and even give injections. And a few years back, Dr. McCullough was asked and accepted a seat on the Texas Board of Chiropractic Examiners, which is that board that governs all chiropractors in the state of Texas based on existing laws. Dr. McCullough has extensive and direct knowledge of the lawsuit that I was speaking of earlier, and I believe has information that all citizens of Texas need to hear, because this lawsuit might very well impact the healthcare system in Texas and your personal well-being. I should also state that Dr. McCullough is speaking on behalf of himself and is not a representative of the state of Texas or the State Board of Chiropractic Examiners. Also, he is not a lawyer, but he does have considerable knowledge of the legal proceedings. So welcome, Dr. McCullough. You doing good?
Yep.
What I want to ask you to start off with is this. The lawsuit between the TMA and the TCBE. There's a real and present danger that the medical community wants to take us chiropractors from being able to diagnose out of what we can do to help our patients. Can you explain in layman's terms what that might mean to our patients' audience?
Well, the lawsuit was about several different things, including several procedures, as well as the right to diagnose. The medical profession under the Medical Practice Act has claimed for themselves that only medical physicians can diagnose health conditions of the human body in the state of Texas. And if you have to, in order to do that, you have to have a medical license. The legislature has not said that's true. And so we went to court, and the court determined that yes, in fact, chiropractic physicians or chiropractic doctors could diagnose within their scope of practice. They have a separate scope of practice than the medical scope of practice. Same as podiatrists, dentists, optometrists have a different scope of practice than medical physicians. And so it was legal to diagnose within that scope. The medical doctors still disagree with the court. So now they want to challenge whether or not our scope of practice to exist in the state of Texas is constitutional.
So tell me, okay, so we're talking kind of legalese here about scope of practice. The medical doctors can do virtually anything they want. Chiropractors can diagnose biomechanical conditions of the spine, right?
More than that.
More than that. Explain.
Okay. Under our current scope of practice, chiropractic doctors can diagnose biomechanical conditions of the spine, the musculoskeletal system, and what's called the subluxation complex.
Okay.
Subluxation complex is a very broad theory that's unique to chiropractic and the chiropractic medicine, and it incorporates all the systems of the body.
And the reason it does is because the nerves that come from the spine go to every cell in the body and all the organs. And therefore, what we believe as chiropractors is that because the nervous system is attached to the brain, the spinal cord, and then the organs, we ought to be able to treat all of those. Is that basically right?
The courts recognize exactly that the nervous system does exist. Everyone recognizes that. And the legislature has said we can treat this complex, and that's what the medical doctors are objecting to. They are saying that because we can treat the entire body, that in fact we need a license to practice medicine, therefore our law is unconstitutional. That's what they're saying in their lawsuit.
So they're saying the current law is existing, and I made mention of that quite heavily a while ago, that our current existing law, they believe is invalid. The medical doctors do, and the courts have even said that, and they want the legislation to come in and rectify?
Not quite.
Okay, tell us.
The courts have said, yet we can diagnose within our scope, but our scope is, the legislature has the right to do this. What the medical doctors are saying that the legislature does not have the right to grant that.
The doctors are saying that.
The doctors are saying the legislature does not have the right to grant chiropractic doctors, or any other group for that matter, the right to treat the whole body. Only they have the right to do that.
Now that seems to me like the tail wagging the dog. How can medical doctors tell the legislative body who write the laws what they can and cannot write?
Well, this is interesting, and by the way, this is unique to Texas. All other 49 states don't have this problem. In Texas, the Constitution, written in 1876, there was a statute or written in the Constitution to govern the practice of medicine. No other state in the union has that.
Okay.
It dictates how practice of medicine is to be laid out. Remember, in 1876, there were no osteopathic doctors, there weren't any podiatrists, there weren't any chiropractors, there weren't any other kind of doctors at all. Even dentistry was in its infancy. Barbers did that back then.
Right.
So the founders of Texas tried to write a law that was in its day very, very broad, but it turned out that it didn't quite turn out that way when the courts started interpreting.
So the medical doctors are going back to the Constitution of Texas and saying that even the law that exists is unconstitutional. Yes?
That's basically what they're saying, that the legislature does not have the power to set a group of people like chiropractors aside and let them do what the legislature says they can do.
So then two questions. One, what would the medical profession like? And two, what can our viewing audience do to help us win this fight? And let me back up. The people of Texas are really at risk here of not being able to have a medical choice down the road if the medical doctors get their way. Is that correct?
Absolutely.
And that takes me to the first question. What are medical doctors really wanting?
Well, this is my opinion.
Yes.
And I think they'd like to get rid of us because
As
we're
in-
their competition.
Because of the competition. So meaning that we aren't going to exist at all, or we will fall under their jurisdiction?
Well, that would be up to the courts.
Okay.
If, in fact, they pursue this lawsuit, because remember, we won the diagnosis part of the lawsuit that they filed against us.
Right.
But that has been remanded back to the lower court to determine whether our law is, in fact, constitutional.
Okay.
If the medical doctors pursue this and they win, then our law is declared invalid. Then the legislature would have to decide what are they going to do with chiropractic doctors. In addition to that, it also could impact many other professions also, because we function under exemption to the Medical Practice Act just like dentists, podiatrists, optometrists, psychologists, nurses, and many other professions. So this could have a huge impact on the state of Texas, citizens of Texas, because we don't know where this would go.
So we're going to have legislative action, but it sounds to me more importantly, it sounds like we need a constitutional amendment in order to even have the law become valid. Is that
Well,
where we're heading?
That's very astute. Actually, that's been something that I've thought about too, because I've been discussing this with many, many people for years. I don't know if that's the case or not. I'm not a lawyer. I'm not a
Right.
constitutional lawyer. The citizens of Texas really have to make their representatives and state senators and representatives know that they want medical freedom and choice. They don't want to be restricted because of an archaic law, or to be restricted like other states. In other states, we have many, many choices. Naturopathic physicians, doctors of oriental medicine, acupuncture levels of doctors are not even allowed in the state of Texas because of this situation we have here. You can go right next to New Mexico where I'm licensed, and we have all of those practitioners.
I read in your bio you can give injections. You can write, is it any prescription you want, certain prescriptions?
Well, certain prescriptions. And
Painkillers maybe?
I can do painkillers, injections, all natural substances in the law in New Mexico. And what was interesting about that is different than Texas, and if you read the court cases in Texas, the court even actually says this when they're giving their opinions. The legislature in New Mexico didn't have to change the Constitution. They didn't do anything. They have the authority to do whatever they want with any group of people. They can say, these folks are, say, optometrists, for example, and they can do X. In the state of Texas, that's not true. Even a dentist in the state of Texas is much more limited than they are in any other state of the union.
Okay, so for our viewing audience, we've only got a couple more minutes. If if I'm understanding you correctly, they are at a great risk of having the choice of healthcare providers virtually eliminated to just one, and that would be a medical doctor, as opposed to, like you said, dentists, chiropractors, podiatrists, whatever. What does our viewing audience need to do? What do they need to understand? Is there a website they can go to? If we want them to act so that they can help us, tell them what they can do.
Well, first of all, they need to get a hold of their senator and representative, state senator representative, and let them know that they want medical freedom of choice. They don't want to be restricted at all. You know,
Okay.
they want to be able to choose who they want to choose and see whomever they choose to see. And that's the most important thing. The technicalities of how that's done in the legislature and all, that's really beyond the scope of my expertise also. You have to have constitutional lawyers. There's things like legislative counsel and things like that. But we as the citizens, we tell our representatives, we want this. And then they do the technical. And then it goes to the courts and the legislature and they take care
So
of it.
we don't need to worry about, like you said, the technicalities. We just need our viewers to contact their representatives and let them know that choice matters. They don't want the medical doctors to dictate and dominate how they receive their care, and that options are what's important to them, and then let them figure out how that goes
I'd
and
say
it
that's,
becomes.
you got that?
Is that pretty
That's
close?
just about close, yeah.
Folks, I can't begin to tell you how important this is. If you're one person, if you're 100 people watching, if you're 700,000 people, we need you, I'm asking you to take action. Your legislation needs to know how important this is. If the medical doctors resue chiropractors, it's just the tip of the iceberg. They will come back and go after all the other professions, as Dr. McCullough has said. They want domination and control. Our legislation can change this, but they only do things, as you very well know, when you get on them and you tell them this is what you need. I treat a lot of different patients. Dr. McCullough treats a lot of different patients with his skill and his knowledge. If the Medical Association resues and wins, we very well stand the chance of not being able to practice at all. I want to thank you, Dr. Tim McCullough, for coming in. Great knowledge and insight, providing us with the information so we can have a choice for the right healthcare provider as you, the viewing audience, sees it for you and your family. There's one more segment to our program, and it's called Ask the Doctor. This is where you, the viewing audience, can ask me questions. So let's take one last quick break, and we'll be right back.
We keep Houston working. HCC, smart decision.
Welcome back. One of the most common questions I get asked, at least weekly, is how is a patient supposed to find a doctor that really wants to help them, the patient, get the best possible care they can, and just not think of them as a number? First, ask around. Talk to family and friends. I believe referrals are the best way of finding someone who cares about you as a patient and not just that number. Another way is to interview potential professionals. Well, this ends this episode of Better Health. I hope you have enjoyed this show. It is my desire to help educate individuals about a variety of conditions and treatment options that exist outside of conventional medicine. I should also state that I am in no way making any type of diagnosis for any condition. All of the comments on the show are for informational purposes only. Any condition that you have or you think you might have should be discussed with a qualified healthcare professional. Again, I encourage you to send me any questions you might have regarding today's topics or any other health-related topic. Until our next show, take care, enjoy life, and live healthy.